Welcome back to the program. We're joined now by Representative Kim Schrier of Washington, a Democrat, a member of the Energy and Commerce Committee, and also co-chair of the Congressional Doctors Caucus. Congresswoman, welcome to the program.
Thank you, Mimi.
Talk about your background in medicine. You're the first pediatrician in Congress, and you co-chair, as I just mentioned, the Congressional Doctors Caucus.
Well, before running for Congress, I practiced medicine, pediatrics in my community, and it was quite a switch to go from the exam room to the House of Representatives. But it's been really important, I think, to bring the voice of a pediatrician, the voice of a woman doctor, and given everything that's been happening in healthcare, that perspective has been really important.
Speaking of everything that's happening in healthcare, I want to start with the cuts at the HHS. The DOJ, the administration has started making those cuts. Here's the Wall Street Journal with the headline, RFK Jr. plans 10,000 job cuts in major restructuring of the health department. What do we know right now about the roles of those people that have been cut so far?
Well, these cuts to our finest institutes of research, to the FDA that keeps our food safe, our drug safe, that approves innovative therapies. These cuts have been outrageous and reckless and seemingly just really thoughtless. We're seeing the firings run the whole gamut, from people involved in basics and basic science to people who have been there for decades and are experts in their fields and are really the brain trust of these great institutions. It is kneecapping research, development, drug approval, food safety in our country. And I don't know how easy it will be, if at all, to reverse those cuts.
I'll just put some numbers up on the screen of those cuts at the HHS. Here is Food and Drug Administration, 3,500 people have been cut. The CDC, 2,400 people. The NIH, National Institutes of Health, 1,200. And Centers for Medicare and Medicaid Services at 300 people. The argument, of course, is that there's a lot of fat and redundancy in federal agencies, and we're not getting rid of the people that are doing important work, but the extraneous, I guess, employees.
Well, that's just plain wrong. And first of all, in our committee, we do oversight for all of these agencies. And the bottom line that we hear all the time is that the agencies are actually understaffed. They're having trouble keeping up with the pipeline of innovative therapies. In order to speed those drugs to market, immunizations to market, and make sure that we are inspecting foods like baby formula, sometimes more efficiency requires more staffing, and this is doing exactly the opposite. Really, it is going to handicap our leadership in the world.
You mentioned research. What is the role of the federal government in health-related research?
Well, the federal government is the primary funder of research. So when you think about research happening at our great universities across the country, if you think of research at places like in my district, it's University of Washington, it's Children's Hospital, Seattle Children's, or Fred Hutchinson Cancer Research Center, that research is in good part funded by NIH grants. And so I just want to explain really on a granular level. Let's say there is a research project going on about a particular cancer drug. All of a sudden, funds are withheld. Say a woman is part of that study is scheduled to get her next dose of chemotherapy and it has to be paused. That pause ruins the study because now the treatments aren't given on time. And so as we see this cascade across the country, as we're kneecapping the research that brings us the most innovative treatments in the world, not only are our universities going to suffer, our country and the entire world will suffer.
Can that research be done by the private sector? Why would that research need to be funded by the American taxpayer?
Well, the private sector can do some of this, but really it's a partnership. And usually what happens is that the bench work gets done with funding from the NIH, and then the ideas go to a pharmaceutical company, for example, for clinical trials. It is a partnership that is indispensable. It is how things have happened in this country, and really, it is one of the wisest investments the federal government can make.
I want to play for you a clip of HHS Secretary RFK Jr. Discussing his plans to reduce staff at his agency, and get your reaction.
Our key services delivered through Medicare and Medicaid, the FDA and CDC, and other agencies will enter a new era of responsiveness and a new era of effectiveness. We're going to consolidate all of these departments and make them accountable to you, the American taxpayer, and the American patient. These goals will honor the aspirations of the vast majority of existing HHS employees who actually yearn to make America healthy. 28 great divisions will become 15. The entire federal workforce is downsizing now, so this will be a painful period for HHS as we downsize from 82,000 full-time employees to around 62,000. We're keenly focused on paring away excess administrators while increasing the number of scientists and frontline health providers so that we can do a better job for the American people.
What do you think of that?
Well, it's outrageous. I mean, he's throwing out words like, we're going to cut, we're going to make this more efficient, and that it's not the scientists who are being dismissed. But that's not true. Scientists showed up for work at the FDA only to find out that their key cards didn't work. So he can say whatever he wants there, but the reality is that, he just admitted that these are incredible people committed to their work, and yet he's firing 20 to 25% of them. So what he's doing is misguided and reckless. And as any carpenter will tell you, measure twice, cut once. And that's not what they're doing. Their best scientists and most experienced scientists are either being fired or threatened with firing if they don't stick with RFK Jr.'s party line, which is not medically based. And we're losing people like Peter Marks.
I want to talk about vaccines, but first we'll let people know that if you'd like to join our conversation with Representative Kim Schrier, Democrat of Washington, you can do so. Our lines are by party. Republicans are on 202-748-8001, Democrats are on 202-748-8000, and Independents on 202-748-8002. We also have a line for medical professionals. If you'd like to call in, that line is 202-748-8003. I want to show you a headline from the Huffington Post. He's full of blank. Pediatrician in Congress, that's you, blames RFK Jr. for child's death from measles. This is from February when there was only the one child who had died. Now there's a second child, unvaccinated, who has died. Quote, I do blame him and others like him who for the past 20 years have been spreading lies about vaccines.
I absolutely put the responsibility on him. For 20 years, he has been sowing doubt about vaccines, about proven safety and efficacy. He's been making parents scared to vaccinate their children, and that has led directly to communities under-vaccinating and now the spread of measles. We have now over 600 people in this country who have been infected. This is still spreading. 2 children have died. And first of all, let me just say it's a miserable illness. I think people sometimes think it's just a rash. It's not. I've taken care of one child who was too young to be vaccinated who had measles. She was miserable. Fevers of 104, crying, awful throat pain, awful ear pain, cough, shortness of breath, and then the rash appeared. And so these are kids who are suffering needlessly because their parents were scared away from vaccinating by RFK Jr. and his ilk.
Now, in his defense, he is saying now that parents should vaccinate their children for measles.
Well, he was clearly told to say that. He said that, and then immediately afterwards backtracked and said he thinks doctors should be treating measles with therapies that are not proven to work for measles. For example, measles is a virus, and you cannot treat a virus with antibiotics. So he continues to churn misinformation and sow doubt. And he continues to make money, by the way, off of a lawsuit against the company that makes the HPV vaccine, which is a vaccine that prevents cancer.
How can parents be completely sure, though, that vaccines are safe for their children? Because there are a lot of parents out there that are scared.
There are a lot of parents who are scared. And as a pediatrician, I worked with those parents and families all the time. Now, first of all, I will say that the reason they're scared is because of RFK Jr., Jenny McCarthy, and others sowing doubt. But I think we all get nervous about any medical treatment. And that's why you have a physician, you have a pediatrician to sit down with, express your worries and your doubts, and hear from that doctor about why it's important to look at the risks and the benefits, to talk about the proven science, and to talk with somebody who you trust. If you trust your pediatrician with your newborn baby, you can trust that discussion.